We begin with major developments in the investigation into Michael Jackson's death. Officials now stepping up their probe to many of the singer's doctors. LAPD detectives are looking at his prescription drug history and talking with his many doctors, while the coroner's office is reportedly looking to obtain all of Jackson's medical records, including radiology and psychiatric treatments. Our NBC station in Los Angeles got this from Police Chief William Bratton about the direction of the investigation.
Is LAPD investigating this as a homicide right now?
The department is waiting for the coroner to make his determination as to what was the cause of Mr. Jackson's death.
Lee Cowan is covering the story from NBC's Burbank Bureau. Lee, I've been saying all along that this was going to become a big issue for a lot of doctors in Los Angeles. What are you hearing?
Well, we've known, Nancy, for quite some time that the LAPD investigators would very likely issue subpoenas in this case because they need to get some of those medical records to go with whatever that comes out of the toxicology reports. And now some of those subpoenas have, in fact, been issued. But, it's a tough issue, as you know, because for physicians there is confidentiality issues that go along with this, and they have to be very careful what they do, in fact, turn over, because some of these doctors could very well find themselves at the other end as a defendant in this case if they release too much information. They could certainly be charged by the family for giving away too much confidential information. So this is the beginning, I think, of what's going to be a long process. Some of these doctors, we're told, have already turned over some of that information. Whether they turned over all of it, we're not exactly clear. But there's a whole host of various doctors that Michael Jackson had been using to get various different prescription drugs. And this is all going to dovetail with whatever comes out of the toxicology reports. I know you've said a lot on the show that some of these results are probably already in. I think that the coroner's office probably has a pretty good sense already of at least what was in Michael Jackson's system at the time of his death, but they've got to go back and sort of start building where the drugs came from, were they prescribed for any real purpose, and all of this is part of that. Nancy?
Lee, I think you're right, absolutely right. And frankly, you're the first person I've heard talk about the confidentiality of this. I think a lot of doctors are going to consider this HIPAA sensitive and not want to play ball. And the criminality aspect is what is going to keep this going. Interesting. And I also agree with you about the toxicology. Lee Cowan joining us from Burbank. Thanks, Lee. The role Jackson's doctors might or may not have played in his death could lead to criminal charges, as Lee Cowan just said. Joining me from the University of California, Irvine, to discuss the ramifications of this investigation are Dr. Charles Rosen, president of the Association for Ethics, and Dr. Zeev Kane, who chairs the university's Department of Anesthesiology and Perioperative Care. Doctors both, thanks for being with us today.
Good morning. Thank you.
Dr. Kane, I'd like to start with you. We're really looking at multiple doctors, and frankly, it seems nobody willing to step up and play traffic cop. Would you think that's fair?
It's a question of HIPAA, and it's a question of what can physician give without violating the issue of confidentiality. And I think that issue was just brought up before.
Yeah, and I think a lot of people may not understand that HIPAA really is a federal law that prohibits doctors and nurses sharing medical information, but the criminality aspect may, really change this. Dr. Rosen, we all know, and you certainly are in the sphere of Los Angeles, we know that when prominent people walk into our offices, we like that. Isn't there a sort of a celebrity-loving aspect of this entire issue?
I think that's a large part of it, if not the majority. But it doesn't negate the physician's responsibility, which is to the patient first. And the physician has the obligation of doing what's best for the patient, not what they want, regardless of how famous or rich they are.
So talk to me about the pressures of saying no to people.
Well, it can be if someone is famous and well known and come in and want something and want this drug or want to be treated this way, you have to resort to what the ethics of everything from the Hippocratic Oath to the medical society's oaths are, that you treat what's best for the patient, not what they want. And you have to have a bit of a backbone to make that clear.
Dr. Kane, so much has been made of sort of the cocktail that may be implicated in this case. One of the medications, propofol, a medication I know you're familiar with as an anesthesiologist. Can you talk to me a little bit about that drug? And do you think it will be found since it washes out of the body so quickly?
Well, first, just to dovetail on what Dr. Rosen said, there is pressure on physicians to do some stuff, but this is outrageous. I mean, Diprivan is a drug that is indicated to induce medically induced coma. That's what it is. For general anesthetic, for sedation, it is not intended to achieve high or to cure insomnia or anything along those lines. So it is outrageous. There's really no any other word for it. Now, if you're going to measure blood levels, after about 60 minutes, you will not find anything in the blood. So at 2 hours, which are the reports that I'm hearing, they will not find anything in the blood. That said, there are other mechanisms that can identify that Michael Jackson may or may not have taken Diprivan or propofol, and that can be in the urine, and that can be in tissues using more advanced laboratory techniques.
So do you, as an anesthesiologist, have any doubt that they'll find the medication most likely as the cause of death here?
I do have my doubts. I really do, because if they use Diprivan or propofol and the blood samples are going to be an hour old or 2 hour old, you're not going to find anything in the blood.
Interesting.
The next step after that is going to be a bit more complicated. What exactly, how old are the tissues, how old is the blood, what exactly they're going to look for, that all remains a question. I'm not so sure what specimens they still have.
Dr. Rosen, I would be remiss without doubling back with you and asking you one question that's sort of out there in the rumor mill today. Are you our next Surgeon General?
I don't know. I haven't heard anything in the last 60 days. I think
Does that mean you've been contacted?
Yes, but
would you like the post?
I would be one of the deepest honors of my life to take it, yes.
And what would be your mandate if you were, in fact, our next Surgeon General?
I think that disclosure in medicine is important, and it's disclosure of industry's involvement in the production of medications, devices, and I think every other headline for the past few years, you can see that this is really lacking. The American public and patients don't know the involvement of industry in medicine on the negative side. Often there certainly are very positive things that occur, but often the push for profit ends up with the American public having devices and drugs that aren't helpful. And so disclosure would be really one of the main goals, and I think using evidence-based medicine outcomes. Does a treatment or a drug work on a patient? Not does an X-ray look good, but is the patient better, is really the second goal.
Well, Dr. Charles Rosen, at a time when the medical establishment is being hammered for not being very ethical and turning the other way in the Jackson investigation, it would be a pleasure to have you back as our Surgeon General.
Well, thank you.
You bet.